Conservative MP is trying to make it easier for doctors to prescribe some psychedelics. Saskatchewan's Tochor has introduced a private member's bill to reduce the barriers that stand in the way of using what's known as magic mushrooms to treat mental health disorders. Tochor spoke about the bill today on Parliament Hill, where he was joined by a Canadian Armed Forces veteran who uses psilocybin to treat his PTSD.
I was diagnosed with post-traumatic stress disorder in 2006 following my first combat tour to Afghanistan. Like many others, I adhered to the orders I was given. I took the medication, I went to the therapy, but nothing seemed to be effective and I was actually getting much worse. After extensive research and conversations with clinicians, I decided to engage in psilocybin-assisted therapy. For the first time in nearly 15 years, I felt peace. I was able to finally integrate and solidify everything I had learned through the years of psychotherapy. It didn't erase my trauma, it changed my relationship with it.
I'm joined now by Conservative MP Tochor. Thank you so much for coming in.
Happy to be here.
Your party has taken, I think some folks would perceive, a pretty hard line on issues involving narcotics in recent years. So help me understand, why is it important to you to make it easier for some people to access this drug?
Because we got it wrong with psilocybin. As a society and as a country, it is a medicine that we've had in our history of humans for hundreds of years. Some of the indigenous people that have used psychedelics or psilocybin. But in the 1950s, with the war on drugs and the craziness of the Nixon administration, it was grouped in with other substances that are addictive and truly are toxic. And psilocybin isn't toxic or addictive, and there's benefits for people such as Josh that we just heard from.
It is, though, it's different than, say, cannabis or alcohol in the sense that it is a psychedelic. It's a mind-altering drug. You talk about it as a medicine, but some people do associate it with, like, teenagers using magic mushrooms. And so I wonder why, as a politician, it is important for you to be leading the charge on this rather than having this push come from prominent voices in the medical community, let's say.
So what got me interested in this as medicine is Thomas Hartle, and that's who the bill's named after. Thomas Hartle was a constituent of mine that, like everybody else that has a loved one that has had stage 4 cancer diagnosis read to him, given months to live, his anxiety was through the roof. So his physician prescribed psilocybin counseling that was approved by Health Canada through the Special Access Program. And it calmed his anxiety so that his body could fight cancer. And it was working. But the government cut him off the 3-year mark and came to see me. And at the time, I had some cursory knowledge of mushrooms, but I didn't think much of it as an actual benefit or a medicinal medicine. But after meeting Thomas, and I started meeting with such as Josh that we just saw, and dozens of other patients that this has helped them. I started thinking, well, maybe there is more than that. I started meeting with doctors and researchers, historians, that we got it wrong with psilocybin. Psilocybin can be one of the treatments for the epidemic of mental health and addiction that we see on every street in major cities across Canada. And this is not about taking mushrooms for recreational use and going out to the forest with your buddies. This is about counseling before a session, having the medicine, and then having also sessions afterwards where they talk through what were those barriers that you used to put up in your brain, and access some of those reasons why people are addicted, why they have trauma in their lives. And it's been shown, studies have shown that it is effective treatment for some mental health disorders and addiction and PTSD, especially from our veterans.
So folks at home may not know, or some will and some won't, that essentially right now a doctor can prescribe psilocybin, but they have to get this approval from Health Canada. So your plan here is basically to take the Health Canada step out of the way?
So right now, you're right. People are prescribed it today in Canada, but they have to get Health Canada bureaucrats to sign off on it. They're not doctors. Neither am I. People at home watching this, talk to your physician. Do not take medical advice from an
MP, a journalist, or necessarily a bureaucrat.
Follow the science.
Yes.
And the science on psilocybin shows that it is safe and effective treatment for mental health.
Well, what I would say, because I do want us to be careful about anything that sounds like medical advice here, is I've looked at a couple of studies and that the sample sizes were quite small. So I don't know, I would not take a position on whether or not the science has come to a hard and fast conclusion about this. But what I would be curious about, when we think about opening the door to access to particular drugs. I think it's easy to think of cannabis. Are you worried that by making it easier for doctors to prescribe psilocybin, that we would see people abusing the system, right? People who do want to use it recreationally, that we might see doctors who would be prescribing this unethically, essentially, and that it starts opening up a slippery slope?
I would say that currently, if you got declined by Health Canada from your physician to have physician prescribe psilocybin, you may go down the street and the many storefronts that are in major cities across Canada would sell you psilocybin. And I don't think that's right for our society. I think we do need the guidelines. We do this is as much as it is non-toxic and non-addictive, it is very potent. And there should be guidelines around who would be prescribed, as we know that if schizophrenia runs in the family, you should not be prescribed. And there's some other specifics that the physician would assess their patients if they're suitable for psilocybin counseling.
When you look at what happened with cannabis, right, where medical access expanded and now there are storefronts on a lot of street corners, I mean, is that what you would like to see happen with
Absolutely
psilocybin?
not. Absolutely not.
Why is that?
The society was sold that cannabis was a benign substance, and it is fairly benign, but there are different safeguards that unfortunately in Canada does not exist. The male brain doesn't fully develop until the age of 25, and in provinces you can purchase as low as 18. So no, there isn't. I get that some viewers and yourself might see some similarities on that, but really two different modes of action and a lot different benefit for the patient versus a recreational drug such as cannabis.
We talked at the beginning about the Conservative Party's past comments on narcotics of all kind, be it cannabis, many other things. The party is interesting because on the one hand, people might say, well, the Conservatives are a law and order party. And then other people might say, well, it's a party about individual personal freedom. And so I'm curious what the conversation was like with your colleagues about you bringing this bill forward, because surely some of them must have arched an eyebrow.
However, there is more on the other side. We heard from caucus members that had loved ones that they believe this medicine gave back their loved ones after a decade of loss to mental health disorders. We have survival stories in the Conservative caucus about former addicts that were living on the street that got their life cleaned up. And so there's a lot of lived experience in the Conservative caucus. We are the law and order caucus. That is why I'm bringing this forward. I don't think that we should be forcing law-abiding citizens to access gray market supply of their medicines. And that's why I'm bringing this forward. And of the hard drugs, we are against hard drugs that are toxic and are addictive, and they should be off our streets.
What about other parties? You're putting forward this legislation. Do you have any sense of whether you're likely to get support from MPs across the spectrum?
I just launched earlier today, but there is a new sense that hopefully that we're working together. If you take Mark Carney's words that he's going to reach across the aisle and work with other parties. Here's a prime example. This is not a partisan issue.
Do you hope to engage the Prime Minister?
Absolutely. Our G7 countries, such as Australia, Germany, Switzerland, even our neighbors to the south, are advanced further along the acceptance of psilocybin as a treatment option.
Okay. Corey Tochor, Saskatchewan MP, thank you very much for this conversation. I appreciate it.
Thanks for having me on.